From the cradle to the grave, healthcare services in Chinchilla are limited. 300 kilometres northwest of Brisbane, the town has about 9,000 residents. There is a hospital, but local women like Hannah Tidd have to leave town to give birth.
Yeah, it's a logistical nightmare.
She's planning to have her baby 2 hours away in Toowoomba.
I think everybody should have the option to birth safely where they live. Travelling isn't always easy or safe either for people.
The Chinchilla Hospital hasn't offered consistent birthing services since 2012, blaming a lack of staff.
Historically, the Chinchilla Hospital has found it really hard to attract and keep doctors and nurses to be able to offer birthing services 24 hours a day, 7 days a week for 365 days in a year.
More than 40 hospitals around regional Queensland have lost maternity services in the past few decades. Last year, 64 women from the Chinchilla catchment drove an hour to Dalby to have their babies, while others chose hospitals in Toowoomba or Brisbane.
What women in Chinchilla can access is a midwife who is based in Chinchilla, who sees them throughout their antenatal care. And for most women, that midwife follows them to the Dalby Hospital and assists in their delivery.
Hannah Tidd was treated at the Chinchilla Hospital after a miscarriage in late 2019, a very difficult experience.
There was just a couple of nursing staff on that night, and one had recently suffered a miscarriage herself, so she was equally as distraught.
Access to care is also a problem as people get older. Retiree Mike Smith wants to die in Chinchilla, eventually.
No, I don't want to live here. No way. This is where my home is.
Mr Smith has been making 4-hour round trips to Toowoomba to undergo testing for possible prostate cancer.
It's a bugger getting older.
Many of his friends have had to leave town.
It takes some of the heart out of the town. It really makes the town less of a place.
This 63-bed facility is the only nursing home in Chinchilla. It's already at 100% capacity and has a waiting list of about 25 people. There are plans for a new aged care home with 81 beds.
We're finding some people who are unable to wait for a bed to become available are having to relocate to Toowoomba and Brisbane and other areas.
It would include a childcare centre in a bid to attract staff.
The ability for people to basically grow in Chinchilla and then pass away in Chinchilla would be a great asset to the community.
There are some public and private options for palliative care, but staying at home until the end is challenging.
We've got a changing population where we don't have the big extended families in place, and so being able to care for someone at home and do all of the caring things as well as have the palliative care is a big challenge for small communities.
No matter what stage of life they're at, travelling long distances for healthcare is a tough reality for those living outside the big cities.
Now, that's accepted in the bush. We know that we've got to travel away for some services, but in healthcare we want to get people home as fast as possible.
Experts say patients have better results when they're close to home, but that's not always an option. Lucy Robinson, ABC News, Chinchilla.